All right, nursing students, here's a list of when to hold certain medications. So number 1, we have digoxin. Now with digoxin, you want to always check the apical pulse, and if it is less than 60 beats per minute, you hold the medication. And that's because digoxin can cause severe bradycardia. Number 2 is beta blockers. Now with beta blockers, again, you're going to take note of 2 things. That's the heart rate and the blood pressure. So if the heart rate is, again, less than 60, we hold the medication. And if the blood pressure is less than 90/60, we hold the medication again. And that's because this medication can cause bradycardia and hypotension. Number 3, we have furosemide. Now, furosemide is a loop diuretic. This time, you want to look at the potassium. So if the potassium is less than 3.5, that means that this is hypokalemia. You want to hold the medications because furosemide can cause an increase in potassium loss. Number 4 is lisinopril. Now, lisinopril is an ACE inhibitor. And one thing that you need to know about ACE inhibitors is that it causes potassium retention. Okay, so this time you're going to look at the potassium. However, you hold the medication if the potassium is greater than 5. That means that the patient has hyperkalemia. Number 5, we have warfarin. Now, this medication, you want to monitor the INR. And if it is greater than 3.5, hold the medication because this can increase the risk of bleeding. Number 6 is morphine. Now, with morphine, you want to monitor the respiratory rate. If it is less than 12 per minute, you want to hold the medication because morphine can cause respiratory depression. Lastly, we have nitroglycerin. With this medication, you want to hold it if the systolic blood pressure is actually less than 90. And that is because nitroglycerin causes that vasodilation. With vasodilation, it will cause that decrease in the blood pressure, especially the systolic blood pressure. So we want to make sure that we hold the medication if it's less than 90. When it comes to antihypertensives, remember A, B, C, and D. So A stands for ACE inhibitors, B is beta blockers, C is calcium channel blockers, and D is diuretics. ACE inhibitors. And it ends with pril. So these medications, an example is enalapril. Mechanism of action is that it prevents the conversion of angiotensin 1 to angiotensin 2. And when this happens, it means that vasoconstriction will not occur. Remember the side effects. Remember ACE. A stands for angioedema. C stands for cough. And E stands for elevated potassium. B. B stands for beta blockers. Now, beta blockers ends in alol, like atenolol. Now, these medications blocks the effect of epinephrine at the receptor sites. So at the receptor sites, this medication will block it. Okay, so that epinephrine will not work on the receptors. Now remember these side effects. Number 1, bradycardia. Number 2 is hypotension. And number 3, we have it masks the symptoms of hypoglycemia. So when the patient is having hypoglycemia, you may not notice it. Now C stands for calcium channel blockers. Now these medications ends in, the most popular one is pain. However, there is also amyl and there is also Zem, such as amlodipine. Okay, now these medications, what it does is that it prevents calcium from moving across the myocardial okay, cell membrane. I'm trying to shortcut this so that you can get that, but at least you know that it prevents calcium from moving across the myocardial cell membrane. Now, things that you need to remember, these are the side effects. Number one, remember that it causes hypotension. It also causes bradycardia, and the patient may experience dizziness. Last but not least, D stands for diuretics. Now, one thing that you need to know about diuretics is that it promotes diuresis. And because it promotes diuresis, we are going to see a loss of fluid as well as a loss of sodium. And remember that sodium and fluid, that retention causes that increase in the blood pressure. Remember that the side effects, once we think about diuretics, remember that there will be electrolyte imbalance. Let's complete this together. All right, nursing students, let us compare aspirin with NSAIDs and acetaminophen. Now we are going to compare these in terms of 4 major categories. The first one is their ability to reduce fever, and that is if it has that antipyretic effect. Number 2, we are going to look at it in the terms of the effectiveness in reducing pain, then if it is able to be anti-inflammatory, okay, and then if it is platelet. Okay, so now let's compare. So, can aspirin reduce fever? Yes. Can NSAIDs reduce fever? Yes. Lastly, can acetaminophen reduce fever? Yes. So we have 3 yeses for fever. Number 2, we have analgesic. That is, can it reduce pain? Can aspirin reduce pain? Yes. Can NSAIDs reduce pain? Yes. And can acetaminophen reduce pain? Absolutely. Number 3 is anti-inflammatory. Is aspirin anti-inflammatory? Yes. Is NSAIDs anti-inflammatory? Yes. Is acetaminophen anti-inflammatory? No. Remember this. It's a big no. And lastly, antiplatelet. Is aspirin an antiplatelet? Absolutely. NSAIDs? No. Acetaminophen? No. Now we have this board to help guide you.